Sanjaya, did Brisbane's three-day lockdown work?
Hi, Danica. I think it was a very reasonable measure that needed to be taken because we had a strain of the virus that's thought to be more transmissible and a person who was infectious for 5 days going up and down the city. So it could have been a very large outbreak, and they've done very good detective work, and there's been a lot of testing done, and I think it has worked. So I think it is very reasonable to move to the next step as they have done now.
And from an infectious disease point of view, is 3 days enough to suppress a potential outbreak, or does a lockdown generally need to be longer in terms of the life of the virus?
Look, Danica, I think for each outbreak we see in Australia, it has to be tailored according to the nature of the outbreak and that particular state and territory and its ability to respond to an outbreak. So I think what they're doing at the moment is very appropriate. And of course, even though the lockdown has stopped, there are still restrictions in place to limit people's movement and of course, continual messaging about people getting tested if they've been exposed or they are sick. So I think all those things are good.
So, given your comments on the three-day lockdown, should that now be a catalyst for all state and territory borders to have a lockdown if there's an outbreak and reopen and stay that way? Does that set the standard, do you think?
Look, as I said, it will vary according to the state as well. So we saw with South Australia, they felt very comfortable with their outbreak locking down the whole state, which, I mean, it was only in Adelaide, but they locked down the whole state. But generally, New South Wales hasn't had to lock down any areas until they had the Northern Beaches outbreak. So I think it really is important not to say that this is what must happen every outbreak, but this is what must be considered. Tailor it to each situation.
Late yesterday, we saw one new case emerge in Greater Brisbane. The person was a close contact of the woman who tested positive to the UK strain. That person has been in isolation since the 7th of January. How concerned should we be?
Right. So if that person has become positive while in quarantine, and then they've determined that that person was infectious during quarantine, then it's not particularly much of an issue. But of course, if there was a period outside the quarantine window where they could have been infectious, then they will have to do the contact tracing again and identify people who could have been exposed.
Let's look at the situation in New South Wales. How do you think that the state is tracking 3 weeks on from the original outbreak in the Northern Beaches?
I think that New South Wales is doing really well. Now, one marker we use is how many cases we're seeing in a 14-day period. And one of my epidemiology colleagues has said about 100 cases over a 14-day period is the sort of red flag beyond which it can become difficult to identify all contacts in a timely manner and beyond which you might see exponential growth. Now, if you go back about from the 29th of December, the 2-week period before that, there were sort of over 200 cases in that 14-day period. You do the last 2 weeks, it's closer to 100. So it's doing very well, and we're certainly not seeing exponential growth. We're seeing a slowing of cases.
That's really great to hear. And the Premier Gladys Berejiklian has said that the state's now in a mopping up phase. What does that look like? Does that mean that the state is now on track to completely stamp out these clusters?
Yes, look, and New South Wales has a track record of doing that. And yeah, we're at the stage now where they're identifying those final clusters, and hopefully we'll get all those contacts in quarantine so that they can't infect anyone else and the outbreak will peter out. The problem, Danica, with this virus, though, is that we know about 20% of people are responsible for 80% of cases. So all you need is one super spreading event to occur to affect things negatively. But let's hope that that does not happen.
Fingers crossed. I want to ask you about the vaccine. Australia's rollout begins next month. Many of us, Sanjaya, will be hoping that life will return to normal. Will it anytime soon?
Not anytime soon, Danica, because remember that even though the vaccines start next month, it won't finish till, I think the government are now saying October. It was initially going to be December. So it'll be some time before we see a significant proportion of the population immunised. Also, although when we talk about the Pfizer vaccine being 95% effective, that means in terms of stopping us from getting sick with COVID. We're still trying to learn whether these vaccines stop people infecting other people with COVID. And given that not everyone who gets the vaccine will become immune, that's going to be an issue. So I think there's going to be some caution for a few months yet.
OK, well, we look forward to seeing how the rollout goes. Sanjaya, Senanayake, thank you.
Thank you.